Welcome, everyone, to a brand new webinar with Dollhouse. We are excited today to introduce to you our brand new device called the UltraClear, which is really a revolutionary laser treatment that is changing everything. Before I introduce our speakers, in case you're not familiar with Dollhouse, you all should be. It's an amazing practice. Do you know that we have 16 female providers, all female? I love it. And 5 NPs. But is the best thing about Dollhouse is that not only do we bring all this aesthetics to you, like injectables and lasers that we're going to be going over today, but we also have weight loss. Anyone like those weight loss shots? Wellness, vitality, and we're also bringing in integrated medicine. We do IV therapy. So we really are, a full service, comprehensive option for all of your aesthetic and wellness needs. All right, let me introduce our two speakers today. So first, here we have Jaimee. Hi, Jaimee.
Hi, how are you?
Good. So Jaimee, if you don't know her, she is the founder and owner and medical director of Dollhouse Medical Aesthetics. She's dual board certified, and she also, when she's not practicing and treating all of you in the practice and running the practice, she is out speaking. She actually trains other physicians and nurses all over the country for a lot of the big providers. So that's really impressive. And then we also are very excited to have Courtney here. Hi, Courtney.
Hello.
And Courtney is also a very experienced nurse practitioner. Courtney's unique because all of her experience is really exclusively in dermatology, so exclusively with the skin. And she also loves UltraClear so much. She has been doing so many of these treatments. She is totally our expert. So without further ado, I am excited to get started. I see some of you popping in your questions already. That is great. We will do the presentation and then we'll answer the questions at the end. All right, so Jaimee and Courtney, the floor is yours.
Might intimidate us a little bit with all those questions, but we'll do our best to answer kind of anything. We're open books, and it's kind of fun to do this live in a different format to be able to provide some like preliminary consults, but we also encourage you at any point to reach out and do some in-person consults as well. They're always free, and that is our time that we give to you without any pressure, just so you guys can kind of learn about anything that you have specific questions on. We can talk to you about downtime. Talk to you about outcomes and all of that. So we'll get started here. So we are super excited about our new laser, the UltraClear. It truly has revolutionized our practice. We are using it all day, every day. It is that busy, and we are just officially launching it tonight. So we're ridiculously excited just to present this to you and kind of show you some of the technology that can truly change your skin and your life. There is not one person that walks through our door currently that we can't treat. I mean, we have pediatric patients on our books. We have Fitzpatrick, which we'll talk about in a little bit, but we can treat all skins of color, and we have been able to treat anything from a Fitzpatrick 1 up to a 6. We can treat scars, we can treat deep wrinkles, we can treat fine lines, we can really get some of the results that you used to have to rely on surgery for. So we're super excited to kind of talk more about that. So Courtney's going to start off by talking about who is a candidate for UltraClear, and then we'll get into some of the technology.
Is it? Oh, you want me
Yeah,
to
there
do
you go.
this one?
Yeah.
Okay, sorry. All right. So everybody is, like Jaimee said, everyone really is a candidate for either one end of the spectrum, or from one end of the spectrum to the other. With our darker skin tones, obviously we have more parameters and things like that. But revolutionary for those of darker skin colors, because before with older modalities, especially CO2 lasers and things like that, people with highly pigmented skin weren't able to have these things. So now we have a solution for that. So I'd say most of our patients have something they're not really loving, some sunspots, some little wrinkles, acne scarring, overall just kind of the sagging fine lines, deeper lines around the mouth and eyes. I think everybody's a candidate, no matter your concern.
Right. And I think a lot of people used to rely on it was either like injectables or it was surgery. And like we truly have a treatment now that can bridge that gap. So I think that's the most important thing to really take away is we used to be able to, I used to hate to overpromise and underdeliver, but with this technology, I truly think that I probably underpromise and we overdeliver, which has been the biggest game changer for our patients. So we'll move on to why patients choose UltraClear.
So UltraClear is going to be the treatment modality for you if you really want zero downtime and really little discomfort. If you're doing 3D Miracle, even some of our Clear Plus, people describe maybe like a little scratching feeling or a slight like feather on your face type of sensation with that. You're in and out of the office usually in less than a half an hour, and you can go back to work that afternoon. So it's an all-in-one solution for all the things we talked about prior. If we go on some of our more in-depth
more invasive procedures, yeah, for sure.
In like the ultra mode or laser coring mode,
Yeah.
we're going to be not only be treating the little fine lines and spots and things like that, but we're going deeper, remodeling collagen, all of that stuff. And we can treat a variety of areas. We have some pictures of scars on the face, scars on the arm. We are doing other things on the chest, face, back. We really can go about anywhere with this thing. But I think the biggest part of it is the lack of pain and the little downtime. CO2 lasers that we've used, or that we didn't have, but other people have used at practices in the past. Usually you're looking at sometimes 6 weeks of recovery. And most people are back at work. Even with our deepest treatment, they're back at work within 3 to 4 days, wearing makeup again, out in social events and all that.
And just to compare from somebody who I personally did have a CO2 laser, and I have had UltraClear. I would say that most of our patients, so our most invasive part of UltraClear is coring. And I would say some patients rate that like up to a 4 and a 5, especially around the periorals. But most of the time during the procedure, they're rating it between a 2 and a 3. But for me, in comparison, a CO2 was a 10 out of 10 as far as discomfort goes. So the fact that we have the technology now with a cold fiber laser to actually decrease that significant pain score and also get them back to work quicker than ever, with the same results, I would say even better, has been the biggest game changer for us, wouldn't you say?
Absolutely.
Okay, so what is your skin type? Of course, we have our Derm NP here, and she's going to take that one for us.
All right. Well, I think all of you can find yourself on this chart somewhere. I guess the whole point of this slide is just that we can treat all of you.
Yep.
So whatever you are on here, from a 1 to a 6, we don't have to worry about turning you away at the door. We might just have to modify treatment a little bit to get to you. So find where you are. We'll know where you are when we see you, and we will adjust your treatment accordingly.
And traditionally with CO2 lasers, what we found in the past is that we could really only treat skin types 1, 2, and 3, which has been really unfortunate for all of our patients that fall into the categories 4, 5, and 6, because they've been really limited. And especially when they deal with things like pox scarring and other types of scarring and skin laxity, we just didn't have those options for them. So for the first time, we're super excited that we can really treat everyone and every age range. There's not one person that walks through our door, I think I said that before, that we can't treat with some kind of modality, between 3D Miracle all the way up to laser coring. So we're going to kind of show you what patients those would be and what category you might fall into.
So these are our 3 levels of treatment, like we kind of been touching on. Maybe we should put this first, but
yeah.
The superficial, like we're talking about, the minimal social downtime, in and out in a half an hour out of our office. Super great for fine lines, pigment, even little reds in your face. We have some good pictures of actually Jaimee, and you can see the decrease in the reds, little sunspots, things like that. That's great for any skin type. So is the moderate level. That's where we're having a little more downtime. You're looking a little red, sometimes a tiny bit of bleeding with our moderate procedures that is gone within a couple days. 72 hours later, you're up wearing sunscreen, makeup, all that, back at work. Even with our advanced or laser coring and some of the customized UltraClear procedures, people are really getting back out there probably by day 5, 6 for us. We haven't had much of a lag time with that either. This one, as we're, like we said, with the skin types 1 through 3, we're pretty clear for all of them to do any of the deep laser coring. We do modify things a little bit for those darker skin tones with our advanced modalities.
And I think when it comes to downtime, I would say I usually use this as a rule of thumb. I usually over exaggerate it, so people are thrilled when they have less downtime. So for me, I personally did Ultra and UltraClear under my eyes, and I was prepared to be kind of out of the social climate for a couple days, but within 24 hours, I was at a 40th birthday party. So
and Jaimee can't, she can't be out of the social climate for that long.
So I really think that this is going to be variable, but we're giving you kind of the extremes so that anything less is just going to be icing on the cake. So these are 3 different levels of treatment. So Courtney touched on like our minimal downtime procedure called the 3D miracle that really stays in the stratum corneum, just that most superficial layer of your skin. You really have like 2 hours of some redness, maybe some like sunburn-like feeling sensations. We really set you up for success. Those of us that were the guinea pigs really kind of nailed the aftercare for it now. So people do great. And it's honestly one of those treatments that can become addicting. Like, when's the next time I can get another 3D miracle? So we do like to package that one. Then as we get kind of further into the epidermis, we start hitting our modality that's UltraClear. So we're kind of going from Clear Plus down into UltraClear. So once we get down into the dermis, we're definitely in UltraClear mode, and we're working on remodeling that skin. So we work on our deeper lines, the fine lines under our eyes, thickening some of that and getting some collagen and elastin building under the eyes. And then we get down to laser coring. So this is the closest thing that I have personally found on the market to a facelift. Without being a surgical procedure. So for some people, we always are truthful, like you're definitely a surgical candidate. But for those that don't want surgery or kind of in between that stage, maybe like late 30s, early 40s, early 50s, this might be the perfect treatment for you to get those results without the extreme downtime and such a severe procedure like a facelift and the cost. So we have all the things. We have 3D Miracle, we have Clear for pigment, we have UltraClear that gets collagen and dermal remodeling with pigment, and then we have laser coring. But the best part about this is we can customize it in the treatment room for you. Even if I'm booking laser coring, I'm definitely not just going after that. We're going after the pigment, we're going after the fine lines around the eyes, we're going after the laxity maybe around the mouth, and then we're really coring those areas that we really need some of that skin tightening in. So really with these 3 levels of treatment, we can pretty much target anything. Anything to add to that one?
I think one part we kind of missed out on, the UltraClear for acne scarring, since I am the derm NP, I think it's huge. That's one of my biggest complaint from patients after we fix their skin is the scarring that's left behind. So finally something good and relatively painless for this is a huge thing for me and a lot of people out there.
And for all of my people that have, or patients that have had some type of surgery, whether it was cosmetic, like a breast lift, or for those of you that have had either like mommy makeover with like a tummy tuck or just C-section scars, we can truly customize that ultra mode or UltraClear to really target those scars and get some good collagen remodeling. And there's some good before and afters coming for you there too. So a little bit about Aclaro. So I had the pleasure of meeting our sweet Aclaro team in the late 2024, and they really blew me away with the technology. I mean, they have really taken, CO2 came out in the early 90s. So when people talk to me about, oh, I'm going in for a CO2 procedure, it really makes me cringe because I'm like, we have advanced this technology so far that no longer do we have to put up with the pain and the downtime that comes with CO2. And then in the late 1990s, we went into the non-ablative lasers. And then finally in 2007, we were able to kind of revolutionize that technology and move into the mid-IR fiber lasers. But then in 2018, Aclaro was founded and launched the best device on the market, which is, in my opinion, which is the UltraClear. It was FDA cleared for fine lines, wrinkles, age spots, scar revisions, you name it, we can resurface. And then in 2024, we had FDA clearance for benign pigmented lesions and some vascular dyschromia. So there is not one thing that this machine truly cannot cover. It is in just the 2 short years that it's been really launched, it is in over 50 countries, which is ridiculously impressive for anyone who knows the international market. But that's why we are treating patients in Africa. We are treating patients all around the world. And this truly, we are so lucky to have this in Montana, let alone Great Falls, Montana, that only has about 60,000 people. So this is technology that is beyond its years, but in our hometown. So we'll see if this video works. I can't make any promises after what happened at the very first video, but this is just kind of a look at the 3D IntelliPulse technology and what this device and truly why we can customize it. There is less discomfort with this treatment and decreased downtime, and let me show you why. Oh, we got it.
Oh, I'm so sorry. Well, look,
That's
we
okay.
will include all of these videos in the follow-up email that you'll all get this weekend, okay?
I love technology, but anyways, we can always, you know, kind of turf. So anyways, the main thing about this is founder and technology officer behind the UltraClear, was able to find periods of thermal rest. So traditional CO2, we can blast some energy into the skin and we can get great results, but we have increased downtime, like we talked about, and increased pain. But this device is different because we can actually put that energy down into the skin, creating channels, put the energy down, and then have periods of thermal rest in between that, yeah, you can show the picture at least.
Yeah, well, let's show the picture to you guys here.
Periods of thermal rest that allow for, there we go. So you can
the
see
red and the blue there,
yeah,
that's what we're looking at.
Yeah, but you can see those periods of rest with the blue, and then the energy being delivered down deep into the dermis with the red, that allow for the results that we want from the energy being delivered into the deep dermis, but also those periods of thermal rest so that the skin actually has time to heal, and we have decreased discomfort, or we have increased comfort, decreased discomfort, and patients recover a lot faster because of this revolutionary technology. This is also what allows us to treat Fitzpatrick's 1 through 6, because we can control that heat and that coagulation, which has been amazing. It also has micropulse technology. So these are really, really, really quick pulses down into the epidermis, the deep dermis, or whatever we're actually targeting, which makes this treatment really tolerable for most patients. Every once in a while, we have somebody that can't tolerate it, but that's very few and far between, but just know we'll work with you and your discomfort to get you the results that you want. We might just need to space those treatments out versus going hardcore within one treatment.
And we do have ways to decrease your treatment while you're there. Topical numbing for sure, when we're going deeper, especially with the laser coring. And we do have nitrous oxide.
Yep.
Everyone,
so we have
laughing gas if we need it.
And we have Pronox, like Courtney said, that's included in all of our coring treatments now. So that's totally up to you, but it's a 50-50 blend of nitrous oxide and oxygen, and it's patient controlled. So it's out of your system within 3 minutes, and you are driving home. From somebody that is a complete wuss like me, I do it for almost everything because I don't like to be uncomfortable. It really just relaxes you enough that you can somewhat enjoy the experience and then also reap the benefits of the results. So let's see here. So team, do we think that this is going to work?
No, they're
okay. Okay, love that.
That's okay. All of the videos will be in the follow-up email, so make sure you guys look for that.
Perfect.
Thank you.
These videos are phenomenal, so I do encourage each and every one of you guys to watch the videos, but this is just talking about the patient experience and what it's like. So this is kind of what the skin looks like once you're done. We do actually have something that we use after called PDGF that we will talk about, but PDGF will make it so by the time that you actually see, you can't even see these little channels that we created. But we're ablating the superficial areas of the skin. We're also, this one's actually UltraClear that is on the screen right now. It is not coring, but we're also creating little channels down into the skin to deliver that energy. So you really can get good collagen remodeling, dermal remodeling, and collagen production with something as minimal downtime as the UltraClear. For some of my clients that have more lax skin, we really want to get closer to the results of a mini facelift per se, or an eyebrow lift. Then we do need to talk about some coring. However, UltraClear, especially for the perioral lines, the laxity under the eye, we'll show you some of those before and afters, but UltraClear is the choice for you. If we're really just talking about clear, then if you're booking a clear procedure or a 3D miracle, we're mainly talking about just kind of getting a superficial dermal peel per se, like a light chemical peel almost, but also targeting some of that deeper pigment with the clear and the clear plus. So kind of bypassing that epidermis and into the deep dermis. So we can really customize each treatment for you, and there's not one person that, puts something in front of me that we can't improve. So that's where it really comes into play, like coring for those that have the really lax skin, UltraClear for those maybe that want some tightening around the mouth, tightening under the skin, and pigment at once. Clear for those who are just targeting pigment and deep pigment, and then 3D Miracle for all of us to keep up on our results, or for those that want the superficial kind of redo every season, is kind of like how I like to say it. So booking one each season, or stacking those treatments kind of back to back over a period of 3 months is also a great option. And we can talk to each and every one of you individually about that. Anything?
And I think just while you're looking at this picture, since we have it pulled up, you can see the white rings. And then you can see in the middle is the darker spot. So in that picture before from the video that didn't work, that's where those channels are going down, and the depth varies depending on what we're doing.
Yep. And we can also customize that for, you know, 1 drill, 2 drill, 3 drills. That's kind of a scary word, but just know there's actually no drilling. That's just the word that we use for the technology, but that's actually just creating those channels down. And we can actually customize that for each and every condition. So if you do have some deeper lines in some areas, then I might increase the drills and increase the coag, kind of depending on each individualized patient. So there is a lot of science and a lot of art to this. But just know you're in the best hands possible.
And we do that all in one treatment.
Yep. Good point.
Yep. Oh, this one wants to work now, maybe.
No.
Oh, there we go. So this is kind of what we reviewed. This is just a patient experience where the provider is actually customizing the treatment for them. It doesn't look as scary when you see it in person, but we can customize the shape and the size so that it fits your face perfectly. And he is just going area by area, providing UltraClear technology to this top of the skin. And this is actually going deeper, and this is going down into the dermis as well for some remodeling there. So this patient's getting an all-in-one. So with one little swoop there, they're getting some epidermal treatment, some deep dermal treatment, and they should expect very little downtime, like 3 days, sometimes some redness, some swelling that we deal with, sometimes some itching. And we kind of walk you through that step by step, but just know that you are going to have the best skin of your life once you are done with one of these treatments. And it really is less painful than it looks, wouldn't you say?
Oh, yeah.
All right, we'll move on to the next. We'll see if this works before we explain what's going on this slide.
So 2
There we
months
go.
ago, I had my first treatment. Absolutely no pain, no recovery time. I was a little reddish pink, maybe for a day, and that was it. And the results were great. And this time, 2 passes, absolutely no pain, and I can't wait to see what's next.
So I don't want to set anyone up for failure. She's just really tough. The fact that there was no pain, but it should be minimal pain, especially with UltraClear. We should be able to maximize the numbing for you so that you really feel very comfortable in our chair. And if you don't, you need to let us know. But really, it is a very addicting procedure, I would say. Like every time one of our patients gets it done, they're asking, with the exception of coring, because that's more of a once and done thing. But when we're talking about 3D Miracle or UltraClear, when's the next time I can get one? Because my skin has never looked more fantastic. And I would say right now, the big trend is little to no makeup. That is really what we're seeing. People are wanting to be more natural than ever, but they want to go out of the house looking and feeling confident. And so this is like truly, like, I think this device should be renamed to be called like the ultimate filter or something like that.
Yeah.
Because it truly looks like you have a filter on your skin, but in person versus the technology world that we live in. So I really, when we first met our rep, I'm like, that's really what your skin does not look like that.
Yeah.
But it was.
It does.
And so we
Yeah.
are so proud that we have this technology that can deliver that glassy, smooth skin. And like this patient said, she was pretty comfortable. She rated a 0. I'm a big wuss, so I'm more like a 3. But just know that we will make this the best experience possible with the maximum results.
So 2 months.
Okay, so now we're going to get into some of the before and after. So this is going to be our superficial. So this is our stratus corneum. And we're going to talk about the 3D Miracle. So that's where we're targeting just the most superficial layer of skin that you actually have. This one has maybe like 2 hours of redness and a little bit of like a feeling like a sunburn, but you actually get really amazing results with this. So I don't want anyone to poo-poo or downplay this one because it is an absolute fantastic result for the little downtime that it actually has. So this is one of our own, Miss Sydney Scare, but she is in her late 40s, even though she looks like she's in her 30s. But this is her before and after picture. Like I said, this is why I want to rename it the True Filter or something along those lines, because this is 2 weeks post one treatment. You can see the fine lines around her mouth have improved, her overall clarity in her skin. She has no makeup on. She just looks absolutely fantastic. And that's why before and after photos are so important, because some people are like, I don't remember what my skin looked like 2 weeks ago. And then when you see the before and after, it can be truly just absolutely amazing. Yeah. So she was super thrilled with these results. She actually was one that did have a little bit of swelling day 1. So So I'm not saying it's completely out of the question, but some people will have a little bit of swelling that we can deal with, but a little bit of swelling leads to amazing results. So don't be afraid of that.
And I really like take note of the reds on her cheeks and then on her chin. That's incredible to me. I mean, a little bit of rosacea that we'd spend years and years treating with topical things is virtually gone.
So you're saying it's actually an affordable way to treat.
Well, yes, there you go.
And then this is actually my forehead. So this is 1 week post one treatment. I do have some scarring up in the top of my right forehead. And that has drastically improved since a 3D miracle. And you can just see my overall tone, texture, and luminosity of my skin has definitely improved. And that's after just a 3D miracle. And then this is the side profile of my face as well. It looks like I have a little rosacea next to my nose there, a little bit of irritation, some pigmentation on my cheeks, and you can see it. It truly looks like I have a filter on my face, and I have no makeup on. So, and you can tell it's me because I got that little mole on the left side of my lip. So that's just a 3D miracle as well. This is another 3D miracle. We can't take credit for this one. This is another provider, but this is 1 month post one treatment with a 3D miracle. Same thing here, 1 month post one treatment there. You can see the luminosity in her skin. She's really getting back to that true skin tone that she truly is, right? Everyone thinks that they might be a darker fits, but I'm like, I wonder what's hiding underneath. And you can see the decrease in her pigmentation, especially along her hairline. It's unbelievable. And across her cheeks and just kind of all over. This is a really great example of what this can do for darker Fitzpatrick. So this is 1 month post her 3rd treatment, but the luminosity that she has gained in her cheeks, her nose, her forehead is amazing. She looks like she's truly glowing. So like I said, for those patients that really don't want to wear a lot of makeup or as minimal as possible, this is the treatment for you. And like, that's a good example of why we stack some 3D miracles. We don't stack like coring or anything like that we'll talk about, but 3D miracles can be stacked together. So this is 1 month post her 3rd treatment, and you can see the improvement in her skin. This is a good example too of somebody that you can really see the difference in the 3D miracle. This is 5 weeks post one treatment. However, for this particular patient, if she had the budget for it, I would really encourage her to lightly core her neck as well, because you can see the decrease in the pigmentation and even the improvement in those deep set lines. But I think 1 round of coring for her would give her years of an amazing looking neck, wouldn't you say?
Yep.
Okay, then Courtney's going to talk about more of our moderate treatment. So this is when we're leaving the epidermis and we're going into the deeper dermis.
Yes. So this is what these procedure or the 3D miracles, what Jaimee just touched on. So these are the UltraClear. Also, there's some Clear Plus worked in here, which is a touch over the 3D miracle. So just keep that in mind. And you don't have to say which one you want or whatever. Just come in, meet with us. We'll kind of walk you through your skin concerns and what we kind of recommend. But here we have a little bit deeper, like Jaimee said. This is also one of our own here, our doctor. Yeah. And she has she was working on the fine lines or the deeper lines, I guess, around her mouth. And you can just see in her cheeks, even you can see the small bits of pigment on the cheeks that are completely gone in the follow-up photo. She does have some lip gloss on, but hey, other than that, she looks completely different.
She was thrilled because she didn't have any makeup on. Yeah, and I truly thought when my staff took that photo that she had a filter on because she looks like she does. But truly, the dermal remodeling that we got with Ultra on her perioral lines and her nasolabial folds is unbelievable. And then she did a pass, I think, of UltraClear over the top. So that's when we say we can customize every treatment for your specific skin. This is why we do that.
Yes. We like guinea pigs, our staff. So this is not ours. So we can't claim this one, but this is 5 days after one treatment. So like I said, with the downtime on the Ultras, that moderate level, 3 to 5 days is what's listed, and really 5 days. I mean, I feel like she could have gone out 2 days ago.
Yeah.
She looks incredible. She can see she has some acne scarring and some hyperpigmentation, probably from acne as well. And that's decreased incredibly in just 5 days after one clear. And that's actually a clear. So that's not even as deep as the Ultra or the UltraClear. This one is my favorite. This is
the derm would say that.
Yes, this is not mine. This is not ours, but she has a very large sunspot on the side of her eye, as we all can see in the before photo. I would recommend this patient have a derm consult before touching this. If you came in with something like this, we would probably have me or your dermatologist look at that, possibly biopsy, just make sure everything's okay. And then heck, go ahead and start treating. And that's just with our clear. You can see after one treatment, she's incredibly improved. And then after the second, it does look like she has a little bit of makeup on, but 4 months after her second treatment, this spot is virtually gone. Love it. Again, here we have some hyperpigmentation melasma going on with this young lady, and looks incredible. And that's 2 treatments, and you can see that she's maintained it for 10 months, almost a year, looking great. If she wanted the residual picked up, I'm sure 1 or 2 more treatments would probably be gone.
And being able to control that thermal energy with those periods of rest and being able to really customize every treatment for each patient allows us to treat melasma, because in the past we've struggled. We do use our Peak Away, which is also awesome for melasma treatment, but there's not a lot of devices out there. Be very careful when you do struggle with melasma, which device you choose, or really make sure that you have a provider that's picking the right treatment for you, because you can actually make that worse by heating up that epidermis and dermis. So just be very, very careful, but we are careful with our practice to make sure that we're only getting improvement with our melasma patients and not setting them up for disaster.
Yes. And another note on this lady, she's at least a skin type 4. So one of our darker pigment patients was able to get great results. I guess she's not ours, but I wish she was. All right, and this is a cool picture of a hand, because everybody says your hands tell your age. So if we're able to take some of that aging away from your hands, it does a lot for people's self-confidence, and your hands are always out there. So this is pretty incredible. 3 treatments, because a lot of those sunspots on the hands are going to be a little bit thicker, what we call seborrheic keratosis. So those are going to require a few more treatments. But this is incredible. Virtually they're gone almost. So this looks great. And another example of a different area that we can treat with this laser. This one is not ours also. This is only 1 treatment. I think it's incredible to note the fine lines around our eyes in the dark. You can see the dark purple. It has improved, but we could even, and just know that we can't even get better. I know some people are wondering about bags under their eyes. I mean, me personally, dark circles under the eyes. I would love something like that. And there is a way that we can even get closer to the eyes safely, that's coming in our future too. But in this one, if you just focus on those fine lines, it's pretty great to see.
And you can see the dermal thickening too under the eye that she has experienced too over the 5 weeks. But this customer or this patient, I would actually probably do 1 more round on, just so I can fine tune this treatment and give her some amazing results. But as far as what they have done so far, it's unreal.
Yep. And maybe this was her post-op one, and then maybe she did
another one.
Yeah, you never know. All right, this is a good one for me. I love too. Scars. People have scars for all kinds of reasons: acne, injuries, surgeries, like we talked about. And a lot of times they're very bothersome. And in dermatology, we have our ways to get rid of them in the office, or minimize the appearance of them. But I think this looks even better than some of the things that we can do. So 2 treatments on this. Obviously, we could do a little more remodeling with that epidermis. We could go over this with some 3D Miracle, not go quite as deep on this patient anymore. And I think that would improve the color. So lots of things we can do with this. This one's pretty incredible. This is a customized UltraClear. So they probably did a little bit deeper around the mouth. Sorry, we got kids too. A little bit deeper around the mouth, probably did a deeper around the eyes as well. And then probably went over the top with some UltraClear, just kind of smooth it all out together. But this is pretty great. 1 treatment. This one was one of my favorites. So that's pretty awesome. Of this little guy. So men can do it too. We had a customized treatment on this guy. We don't have the information on exactly what everyone did, but we can get that from one of our reps. But yeah, so he obviously was targeting the fine lines around his eyes, which actually are a little bit deeper. He maybe went around his mouth too, because you can see the nasolabial folds by the nose there has greatly improved as well. And this lady had a lot of red and the dark circles. I think that's where you got to focus here, the dark circles and the red. And this is all with a customized treatment, probably some UltraClear and Ultra combo, maybe some 3D Miracle over the top to help with the red. The red and the pigment, probably a 3D Miracle over the top of this. All in 1 treatment is what she did. And after a week, looks incredible. No swelling, very, very little swelling. You can see a little bit in the eyelids, but otherwise looks incredible.
And also like that, like when we talk about the patients that truly do not want to wear that much makeup, this is the result you want, right? This patient can now leave her house without anything on and she looks absolutely phenomenal.
This little lady too. So she had some deeper lines around the mouth. This is one that we probably talked to her a little bit about coring. We're like, hey, do you want to core? You can really get in there, get some great results with possibly one treatment, or do you want to just hit it a little harder with our UltraClear mode? And she chose that. So they probably customized this a little deeper on the mouth, like I said, and probably did a nice passive UltraClear over the top. Looks really great. This one, I do want to note that in the before picture, she does have bruising on her cheek, probably some filler that was done before the procedure. So that does not have, don't think that we got rid of this huge red birthmark or something like that with this treatment. So then you can see on the other side here that she's 42 days after just one treatment. Pigment, I think fine lines, her skin is much more supple. Her forehead looks incredible. This lady too. So we have a combination of pigment and acne scarring, some pretty severe acne scarring. And you can tell by her age, the scarring is probably decades old. So something she'd been probably just sitting with and thinking she had to live with. One treatment, 20 days, one treatment. You can see how much that's improved. And I bet you this lady came back and did another one and probably has very smooth skin. This one I think is very interesting because we also probably would have recommended, or at least talked to this patient about laser coring versus UltraClear, but I think it's awesome. So she chose a less invasive, not going quite as deep, not quite as painful with UltraClear, but you can see with just 3 treatments, pretty much looks like she just had a laser coring.
Right.
Yeah.
So you can kind of choose. That's when we talk about we could do something more invasive like coring and kind of get it all done at once, or we can do something like space them out and do UltraClear. And she had 3 treatments kind of spaced out, maybe less downtime, but for some patients they're like, let's just get it done and give me the 5 days where I might wear a little bit more inclusive of clothing or something like that, maybe no V-necks, but I think everyone is individualized, so we can help you make that decision, and we can actually change it game time too. So if you come in and you're like, listen, I actually have less downtime than I was prepared for, I can change that in a moment. You don't need to cancel an appointment. We got you, no matter what.
Same machine, about the same time, same people. There you go. All right, and this lady, beautiful type 4, or skin type 4, fits 4 here. Obviously some active acne. I don't know, I'm sure they hit that too, but her scarring is much improved. So is her pigment and redness on the nose. You can see in a little bit on the cheeks. This one's probably one of, I said a great one. I already said I had a favorite, but maybe I have more than one favorite. But I kind of think the lady on the right, it doesn't even look like the same person that we started with.
Right.
She looks incredible. Her eyes are much brighter, tighter. Her fine lines on her forehead, the redness is incredible. All of it. You guys can just pick all that up, and especially the chin area too. That's pretty incredible. Just 2 treatments, and she's still going to continue to improve for months and months after this. So this is only a week out. I'm sure if we had one from today, it'd be even better.
And I'm guessing by talking to Dr. Peck, if I had to, if I was asking, I'm guessing they probably turned up the coag on her and went a little bit deeper and hit a superficial layer as well to get those types of results. So we can definitely do it with the UltraClear. Coring's definitely a fan favorite of mine, but her results from the UltraClear alone, just 2 treatments, is unreal.
Yeah, love it. And there's my favorite little guy, because he's a little guy. So his little scar on his head, and can see that he's not stopping scarring himself as he has a Band-Aid on his eyes still too. And maybe look at that scar in his eyebrow in the middle. So he clearly cut his head open again, but this is pretty great. So probably had to medicate him a little bit, somehow keep him laying down, but I do say that maybe had to comfort him a little bit, but I also say this is super, super fast. He was probably laying on the table for less than 2 minutes to get this whole thing done. So super fast. It's not fun to hold a kid down, but I'm sure he was comforted and probably barely felt it.
Sucker fixes anything.
Sucker. This one, it speaks for itself. That pigment is just completely wiped out, and believe it or not, that's one treatment with UltraClear. This lady, she's beautiful, beautiful skin, probably a 4 or 5 fits there.
I'm convinced she got coring, but I'd have to ask.
I don't think she got coring. It wouldn't be here. Jaimee. Anyways, so she's had 1 treatment of UltraClear. She looks incredible. You can see even under her eyes, if you look up a little higher on the screen there, she had great improvement with her under eye as well. This fellow has some deep pocked scars on his cheeks. You can, if you look closely in the first picture, so acne scarring here, which is, like I said, such a huge, huge complaint and just really overall quality of life changer if you can improve these guys a little bit. His forehead, you can tell he had some scarring up there too, smoothed out, but the cheeks you see it the most, and the redness and the pocks.
And the luminosity in his skin is unreal.
Yep, you're good. This little lady looks incredible, kind of like the one two before. She had 3 treatments, probably a little bit lighter, not a high coig, because the improvement was gradual.
Oh, laser coring. So this is my absolute favorite, and I would say yours too. The most common areas that we're coring right now is the upper eyelid, lower face, as well as the neck. And we can kind of customize those for each and every patient. So let me show you some before and afters, and we can talk through each case. So what is laser coring? So do I dare even press this button? We'll see. You never know. Oh, this is an animation of some laser coring, so I'll let you watch a video that's working for us. So this is the newest laser coring. We can adjust depth, we can adjust size, we can adjust spacing, how close we put those coring walls. But there's really like very limited downtime and very minimal movement. Patients are generally comfortable. Around the mouth is a little bit more intense, but it's only a matter of a few pulses. So usually we can get through it. But the results are going to be the closest thing that I have seen on the market to a facelift without facelift. I'm not saying it's replacing a facelift, but man, have we got pretty close as far as restoring some amazing faces and necks. So we will show you what that looks like. Okay, so this is actually a fellow that we know. So he does have some redness that we're going to go back through and retreat, but this is 2 weeks after his coring. If you look at his, the remodeling around his mouth, that's where I'm really like shocked. Look at his chin. The chin is unreal. He definitely looks younger. We do have some redness, like I said, to work on that we will kind of fine tune at his 4-week mark. But the remodeling around his mouth, the smooth skin that he's experiencing, and this is just the beginning. Really, we don't even expect results with this for like 4 to 6 weeks, up to 6 to 12 months for full collagen production. So the results are going to get better each and every week. And this is just 2 weeks past 1 treatment. And he was absolutely thrilled. So this is not just for females, it is for males. And we can really do a lot with this device. This is one of my favorites. I absolutely love her. She literally looks like we took 10 years off. So this is only a couple weeks after her first treatment as well. Her results are going to get better and better, but I truly think that she looks at least 10 to 15 years younger. We do have a little bit more work to do on her under eyes and around her mouth, but if you can see the significant reduction in her pre-gel there, her gelling has greatly improved. Her pigmentation has improved. Her luminosity has improved. Her under eyes, I mean, I can't say enough about the results that she was able to gain. She got some collagen back in her cheeks that are it's gonna continue to improve as time goes on.
And this one I think is good to mention. She actually came in for a filler consult. She wanted to do filler. She said, just fill my whole face. I just want to be filled. And one of our providers was like, hey, why don't we core you first, and then we'll see what's left to fill. So again, saving a lot of money in filler right now, seeing what's left in her skin, which is great, and it's just going to continue to get better. And then, you know, at the end, if she wants to plump the lip or anything like that.
And look at the lines in her neck. Like I say, tech neck or whatever you like to call it. That's amazing, the improvement that she's had there. This is a fun one. So you can still see the coring marks, and these can remain for 2 up to 8 weeks. But I do meet you back at 4 weeks, because if we do have some of those residual coring marks, I like to take care of those complimentary for you very quickly. But this is 2 weeks past 1 treatment. First of all, the pigment reduction, unbelievable. The luminosity in her skin, the clear complexion, but the deep lines around her mouth that drive everyone nuts, that really show the signs of aging, have improved like tenfold. And from her testimonial, she says every week she's seeing the lines on her upper lip get more and more shallow. So super thrilled with that. As time goes on, I can't wait to continue to walk you through that particular case as we continue through her journey. This one, it's truly like an upper bleph. We did not perform an upper bleph. We did some light coring.
An upper bleph is the eyelid lift, cutting out the saggy skin on the eyelid.
What we all
Lifting
want
that
and
lid, a
what we
lid
all
lift,
we
yes.
all want, but we might not want to actually do. But we did core her upper eye, and then did some ultra and UltraClear under her eye as well. So you can see her eye regeneration. I mean, she truly looks like we turned back time at least 10 or 15 years on this particular case. I didn't show her whole face, but the pigment reduction, the skin tightening, everything about this patient in particular has improved, tenfold. And she says every week she continues to get more and more compliments. So we're thrilled with that. This is not one of ours, the previous couple were, but you can see post one treatment, I mean, just her under eyes, around her mouth, her chin, just the improvement in her skin quality, her neck, just everything about her just looks younger, more youthful, more luminous, more confident. This is not one of ours either, but just one that's fun to kind of talk about. 5 months post one treatment. You can see the significant improvement in her skin in that cheek that has that pre-jowl. You can see the improvement in her neck. I mean, just everything about this case is also incredible. Same thing here. She's one of my favorite ones to look at in the book, but you can see the improvement. Those accordion lines are so hard to get rid of, so tough to treat, and such a needed area of treatment. So you can see the improvement in her pigmentation, in her deep lines, in her fine lines, in the luminosity of her skin, in her neck, almost everything about it.
Pores. She has some bigger pores in there too.
Oh yeah.
And I can tell you the texture. You see patients like the first one here, and the way that their skin feels compared to after, it's incredible.
Want to touch her cheek?
Mm-hmm.
Here's a before and after of some laser coring around her mouth as well. So this is, yep, same lady, just a different angle, I think. 6 weeks post one treatment, but you can see the improvement that we used to put filler in, but because of that, it's not my favorite place to put filler because over time, the weight, just the molecular weight of filler can kind of sag and lip down. So if I can core that, remove that tissue, tighten it up, that's my ultimate goal for them. I want everything lifted from the lower face up, and to keep that good fat in the upper face. So we want you looking youthful, looking like yourself, and getting the results that you deserve. Same thing here, this is the same lady too from the side. You can see all the texture of her skin, the fine lines and deep lines around her mouth, just everything about this case screams like, I want to get treated. Same thing here. This is some laser coring under the eye. Remarkable. She does have some residual redness. This is not our patient, but I would have her come back so I can kind of fine tune a couple things here, but still unbelievable results as far as those fine little lines that we get under our eyes. And with that, I think we are going to turn it back over to our crew here.
Yes, we are ready. That was amazing, Jaimee and Courtney. Thank you. You
Sorry
taught
about the
us
videos.
so much. You did great. So before I take this off the screen, and we're going to get to all these questions you guys have been asking, this is your time to pop in questions, but I will pop into the chat because there are some special bonuses. So those of you that stayed around till the end, we have all your names written down and you are eligible. So the first 5 of you to book the laser coring treatment, i.e. the one that looked almost like a facelift in that one photo, will get a complimentary platelet-derived growth factor treatment, and that is a very nice value, and that will enhance your results. Plus, you will also enjoy the first 5 attendees to book a package of 2 to 3 treatments will receive a 20% off discount. So I will pop in the links right now so you guys can actually see the pricing and you can book on your own.
And I probably should mention the PDGF just to kind of pop that in there. So PDGF is platelet-derived growth factor. It's up to 300,000 times stronger than PRF. It is a biologic that can truly decrease your downtime, increase your comfort, and overall improve the amount of collagen and elastin that we produce. So it's an unbelievable treatment. We apply it post procedure, apply it directly to your skin. There's nothing else that you need to do except sit back and relax. It's going to heat up for about 5 to 10 minutes and then decrease your heat. And then as far as downtime goes, when we say that, I think I should put in the little caveat that you have downtime where you don't want to leave the house, but you're not uncomfortable.
Yep.
People always say like, I look worse, but I don't feel bad. So it's a great time for them to actually go around and get some things done in their house, but they feel phenomenal. And I think that the PDGF really, really, actually, we know it speeds up healing, improves results, and decreases downtime.
Yes.
Did we stop streaming? Does that mean anything?
No, it's good. It's because we're here for question and answer now.
Oh, okay.
Perfect.
Perfect. So, all right, guys, let's get to all of your questions. So the first one, so will the coring method help with loose skin under the chin to help tighten it up?
Mm-hmm. Yep. 100%. Absolutely.
Wow, amazing. So when scheduling one of these procedures, do we need to navigate our normal dollhouse self-care timelines, like with Botox and fillers?
A little bit. It just kind of depends. And when you call in, I pretty much know the majority of our patients. And if you're new to us, that's where the custom consult comes in. But we really work with you to disseminate those out in an appropriate timeline. So if we're going to do something more invasive like coring, then I am going to push out like your Botox and fillers a couple weeks. If we're going to do something like 3D Miracle, I can do your filler at that appointment, do a 3D Miracle over the top. If you're somebody who's had a 3D Miracle in the past and we know you don't swell, I can do your Botox. But if you're somebody that has some minimal swelling, then I'll probably space out that Botox for about 2 weeks after.
Just a little bit.
Just a little bit, or even a week.
Got it. All right. So this is a good question. Do you need to be out of the sun for an extended period of time after the treatment?
You always need to be out of the sun.
She's a sun hater.
No, I'm just kidding. I love the sun. So with any treatment, after we are disrupting that barrier of your skin, you're going to want to be really careful with sunscreen. We definitely say stay out of the sun for that 72 hours until you can be applying your SPF again with the coring and the UltraClears. As far as the 3D Miracle, you can apply your SPF the next day and you're fine to be outside with the parameters of reapplying sunscreen every 2 hours. We do suggest covering your face, all those types of things. And I think the biggest thing for this is if you're investing the money to pay for this procedure is you're going to want to protect it. And the number one way to protect it is with sunscreen. Because those little pigmented spots, they just find their way to come back, especially after we kind of mess with the skin a little bit. So really protect your investment, SPF.
We love Color Science, and that has iron oxide that actually color matches all Fitzpatrick's 1 through 6. So because of that, we are able to give you a nice, safe, clean product that you can apply, and it applies full coverage. You can apply 1 to 3 layers, kind of depending. So we get great results. You look fantastic going out, and you're protected. But you have baby skin, so protect it.
Yes.
All right. So you guys, if you don't mind, stay on a couple extra minutes because we still have some more questions that we want to make sure to get to. Okay. And while we're getting to the last few questions, a lot of people are trying to book, which is great. So you guys, you got to be one of these first 5. But they're saying, how do they know which package to buy today? They want to be the first 5.
That's a good question. So for all of our people that are on today, if you are unsure of which package, don't worry. Just call us in the next couple of days. We'll get you booked for a consult and we'll still give you this deal. So don't worry about that. For a lot of our patients, they kind of already know that they're a coring patient. And just so you know, coring, we're going to do everything. So we're going to core you. We're going to do UltraClear. We're going to work on your pigmentation. We can ultra around the eyes to get some dermal thickening. We can core and remove some of that tissue down lower in the face. So don't be concerned about that. UltraClear, you're really looking for that candidate that's doesn't have a ton of laxity, but more has those deep set lines that they want, or the under eye that is a little bit more hollow or has the fine lines around it and wants to target that, or scars and pigment. And then 3D Miracle is kind of like your baby step into this. If you're nervous about anything, buy a package of 3D Miracle and we can kind of walk you through that.
And that is included in the 20% off.
That's very cool. Yep. Okay. If you buy 3 of the 3D Miracles, and we can either put those all before the summertime, or we can, put them through the seasons. There's not a limit on when you have to actually use this by, but we can help you customize that for you. So 3D Miracle, they're like pigment, fine lines, very superficial concerns. As far as UltraClear, we're working more with like dermal remodeling and pigment at the same time. And then laxity, that's where you're getting into your coring. So if you know that you're somebody that has significant laxity, lower face, the deep lines around the mouth, you want your eyelids to have that true little raise, you want that neck tightened up, that you're our coring patient for sure.
And I will mention that if you booked a coring and you came in and were like, oh, well, you're not really as bad as you think you are, we would make that all right and adjust it either into a package of UltraClear or, refund whatever we need to. So don't worry if you're one of our clients and you think you know what you want and you get there and we tell you something different, we'll make it
We've
right.
never held anyone hostage.
No,
we want
no.
you to like enjoy your results, know you got the right procedure, and just thrive. I always tell people with the downtime, and when I say that, you're just gonna look a little rough for a couple days, but you're gonna hate me for the first couple days, and then you're gonna love me forever because all of our patients end up absolutely well. They might not like me for a couple days, but after that, their results are gonna be so outstanding that we don't even need to incentivize people to refer friends because they automatically get the compliments, and then it just keeps coming.
I love that. Okay, so last booking question, and we'll get some more of the other questions. But how can I book and use the cash that's in my account?
Oh, good question. Just call our office tomorrow, and we can use your Dollhouse cash. So we have a bank savings program that she's referring to, and we can apply it directly to the offer.
Perfect. All right. So, does UltraClear help with any under eye bag situations?
Absolutely.
Yeah.
We're getting really good results with the under eye. In fact, I want to be Cord tonight. No, I'm just kidding. Not Cord, UltraClear. But yes, we're seeing really great things with the eye. And like I mentioned earlier, soon we're going to be able to place little eye shields so we can even laser core up closer to the eye for those that have severe bags, lines, concerns under the eye.
And even like one of our like probably busiest injectors now encourages every patient to really do some UltraClear around the eye before we even consider adding any filler, because for most of those candidates, no longer do we have to just jump right to filler. We can get amazing results with UltraClear alone and core.
Yep.
So is it possible to get laser coring for the face without the neck?
Yep, that's a good question. Our package offer tonight with the free PDGF is only for face and neck, but if you do want it just for face, call us tomorrow and we can get you booked for that.
Okay, perfect. Oh, here's a great little testimonial. Christy says, as someone with melasma, UltraClear changed my life. Thank you for sharing that.
Yeah.
And Christy says, super exciting. Love ladies and your whole team. I will call tomorrow.
Yay.
Christy.
Thank you.
And thank you, Shanna. All these great shout outs. So, okay, just to make it clear that she's saying someone else saying I'm still a little confused. If I signed up for the coring, would it also be helpful to buy the UltraClear treatments and use it later, or is the UltraClear part of the coring?
The UltraClear is part of your first treatment. So you get that complimentary with your coring, just because I can't leave a face half done. If I improve the laxity, I'm not leaving the pigment behind.
So what she's saying is we core the certain areas that need it and we UltraClear the rest of it.
But is it helpful to buy a UltraClear package while it's on sale? Yes, because you can use that just to maintain your results down the road. So if we're talking about, so we're doing like the big guns to start and then just kind of like keeping up on your maintenance treatments, you can either do 3D Miracle or do UltraClear. But I would say if I was going to go all in on the best package possible, it would be to buy a laser coring package and an UltraClear package, because that would give you 3 UltraClears essentially, because one's included in your coring and then 2 down the road. And we are set this year as far as your treatment plan goes.
And probably longer.
That sounds amazing. Okay, so guys, have either of you had UltraClear?
Yes, I have. So I started out with a 3D Miracle. I numbed, this is important, I numbed half my face, the right half, and I did not numb the left, just to see. And I thought it was the same. If not, I kind of actually appreciated the side that wasn't numb because I didn't have that tingling sensation. Like a Miracle 3D is 3D Miracle, sorry, I didn't mean to say that, is done in the office in 20 minutes. We can literally apply it almost to any single patient that walks through our door, and they do not require any numbing. So yes, I had that. And then I came back through and I wanted some dermal thickening under my eyes. And so I did a round of Ultra, and then I did a 3D Miracle over the top. I was obsessed. I only went deep. I should have went deep and shallow. So I learned that lesson on myself. And now for all of my patients that we treat with under eye, we go deep and shallow, more superficial. And then we do kind of a layer of either 3D or UltraClear over the top. So we can customize that for you. You do not have to memorize that. But yes, I've had it. Yes, I'm thrilled. And yes, I can't wait for my next one.
And I'm booked. I've been booked before, had to cancel for actually an UltraClear event last weekend.
Oh yeah. It's hard to be
Jaimee
busy.
might do it tonight. She
Yeah.
might do it tomorrow. Or I'm going to see Brooke next week.
That's so exciting. And so how far apart should people expect to have these treatments?
It kind of depends. I mean, if you want to spread it out season by season, I always say we're going to treat until you have the results that you want. So I kind of stack two for myself personally, 4 to 6 weeks apart, just so I could get that pre-summer kind of glow and rejuvenation. So I didn't have to wear a lot of makeup, just some sunscreen. And so I stack two. So sometimes I'll stack 2 or 3 for a patient, depending on their pigmentation, or we can treat you once now, once at the end of the summer, and once come like the end of fall or early winter, just to kind of keep up on your results. So it's kind of up to you, and we can help you customize that as well. But you can never have enough 3D miracles in your bank because you can use those all day long.
Yeah, absolutely. Okay. And Sherry says helpful information. Jaimee and Courtney, sounds great. Thank you.
Hello.
All right. So I have a question here. While we're here and while we have some of our patients, I know UltraClear is brand new, but is there anything else you can maybe tell us and tease us of what's coming soon or what else is new?
So we love our new PDGF, our growth factor. We have applied that topically post-treatment. We're also injecting some growth factor under the eyes as well for some regeneration. So that's been really fun. We have a new integrative medicine program where we're treating patients really like kind of finding the root cause of some of their illnesses and reversing the damage that has been done. So that's been amazing. We're growing in that department. We have a new machine coming for microdermabrasion facials. So kind of similar to the Diamond Glow, but an upgrade. It's called the Glassy. So that's on its way in the next couple of weeks. We have so many things, but UltraClear is really the one device that I know I can use on any of my patients. And then the rest of it is just fun and cherries on top of the cake. Would you say? Yes, I agree.
I love that. Okay. Oh, here's another great little testimonial. And Lori says, thank you. See you soon. Thanks, Lori. So Brooke is saying, just a comment. I had my 3D miracle on Monday and I went to lunch right after the procedure. It really did just feel like a sunburn and I had a little swelling and redness yesterday. Today I'm beginning to peel with a little tightness from the swelling. I'm looking forward to the results when I come in for my follow-up.
Awesome. 2
And
days.
I
That's
like
great.
to tell people too, it's not truly, I mean, some people peel, but most people just pill. So they like just in the shower, they just have some slight pilling when they're washing their face. It's really not like a thick peel, like a chemical peel. So you get the same results, but without like the shedding of the dead skin.
The dramatic
The shed. And we can also pair, for those of you wondering, a dermaplane before a 3D miracle for ultimate results. It's a little spicier, I do have to warn you. I have done it. It's just a little bit spicier, but the results are amazing. So if you do want to do that, we can just add a dermaplane onto any of your 3D miracle packages.
I love that. That sounds so great. So thank you all so much. Sorry we went over for a couple minutes of time. I know everyone's time is so valuable and you're probably waiting to get to dinner with your families. Thank you, of course, to Jaimee and Courtney after your busy day of seeing patients to spend all this time educating us. It's so helpful just to hear it straight from you guys, the real, what's going on.
Yes. We apologize again about the videos. Those will be coming out. They're nothing
That's okay.
like
you can blame me. I'm sorry.
Yeah.
It's
No,
my fault.
It's not a game changer for anyone, but they're just kind of fun to watch. But just know each and every one of us, you're in good hands. We're going to customize. We're going to make sure that you get the results that you want. And we're going to make sure that you're comfortable throughout. So thanks for joining us tonight on our webinar.
Yes, thank you guys so much.
Yes, thank you all so much for spending your valuable time with us. We look forward to our phones ringing all tomorrow and helping to get you guys all scheduled and get as many of you as possible to get these great promotions. And most of all, to help you all just look as beautiful and confident as you want with your skin. So thank you again, Jaimee, Courtney. Thank you for everyone that joined us. And we look forward to seeing you all for UltraClear at Dahl Aesthetics soon. Talk to you soon.
Thank you. Bye, guys.